So the story is global, it is national, it is regional, in the sense that suicide cases are high now. Very high. Just last year, a lot of suicide cases about a student falling from a tall building in school, about a doctor committing suicide, policeman shooting. So a lot of cases, right? And these are people that we dine with, we work with them, we train with them. How come we never saw any warning sign? Back at where I come from, the Upper East region, we do not have what we call Pantai here, or Ankafo, or Accra Psychiatry. There's no mental health institution. And there are a lot of people battling stresses every day. So where is that structure where they can go into? Can't you see me? It is happening everywhere, even on our road. See what truck drivers or even private drivers will do. Are you using TV licenses to drive? Then they'll use the insultive words. We all know them. If I have been cured of depression, it takes my own efforts and the medications that you are put on to set you back to balance. If you say it's not curable, how come you take malaria and then you are fine? Your feverish feeling body is gone. If you are battling with any stresses of life, you are dealing with alcohol, drugs, mentally you're unstable, you sit down and you are fidgeting, you're like you're shaking, your mind is not able to process things, daily things that you used to process.
Hi, and welcome to another episode of The Heartbeat. When we say heartbeat, you say one heartbeat at a time. I am your host, Dr. Nanaja Kuniedu-Jani, and today we are going to have a very important topic which borders on everybody. Because it can be you, it could be anybody, it could be a family, it could be your child, it affects all human lives. This topic is so much important that it's very touchy when we talk about it. I feel a bit emotional in a way. It's kind of bring a bit of a mixed feeling because people get there. All of us can be there. And I think that to do this for us is no other person than my own daughter, Gifty. I'll allow her to introduce herself because she wears many hats so that we get to know what she's doing a very amazing job with her foundation. And the topic we are going to talk about is mental health. Gifty.
Hi, Mommy.
Welcome, darling.
Thank you so much for having me.
How are you?
I'm doing well by His grace.
Okay, so in a minute, who is Gifty?
Okay, thank you so much for the question. And to anyone watching or listening to us, thank you so much for your time. My name is Gifty Atampugbire, now known as Mrs. Blessed Bauer. Yes, so I'm the founder of Healing Wills, Public Health at Your Doorstep. It's a personal initiative that I embarked on in 2010 from Upper East region, Bolgatanga to be specific, as a young nurse, where I realized that a simple communication, education could really avert a lot of unnecessary deaths, like meningitis. As you all know, when we are talking about CSM, it's usually in the north that covers a lot of death too, right? And I'm like, so why didn't this community nurse come to tell us that don't sleep together when it's hot, or open your windows, and then we are just recording this on CSM. So I just said, okay, this is where I will fill that gap. And so from 2010 till date, I've been doing so much on public health issues. You can find me. In fact, if you Google right now, the nurse with the megaphone, it's my name that will pop up. Or the nurse preacher, you will see me there because that's where my passion stemmed out from. Now with the mental health aspects, it was also a gap I noticed in 2015 when I was also battling depression. Yes, I'm not shy to say it because that's the reason why I'm advocating for this. All right. If I'm able to tell you that I have malaria or typhoid, I should equally be feeling safe to tell you that I am depressed or I am contemplating suicide. And that is why I am embarking on this journey where it is okay to talk about your emotional feelings. And it is also even important for community, family, friends, colleagues at work to support you.
And because if you don't talk about it and it happens, then people go about, oh, she should have spoken to somebody. She should have said it. She should have at least mentioned it.
Exactly.
So, it's very important. And I know that mostly people shy away from mentioning because of stigma.
Stigma, yeah.
People stigmatize when they get to know somebody tried committing suicide, somebody tried
Exactly.
somebody is depressed and somebody tried avoiding people and all that.
Yes.
Instead of us to open our arms and embrace,
Exactly.
we rather shy away from them, we rather push them away, and that's what makes the condition worse.
Worse, exactly.
So,
exactly.
Gifty,
Yes, please.
this topic is quite emotional to
Yes.
me because, I mean, from time to time, we all get there
Yeah.
in a way.
Yeah.
It may not manifest for people to see, or it may not manifest in its latter part or its stage that somebody can see that, no, I realize that something is changing in you.
Yeah.
And even that one, it takes somebody who is very close and caring to see that, no, what is wrong with this person.
Yes.
So when we talk of mental health and mental health first aid, because that is what you've been preaching.
Yes.
What is mental health first aid?
Okay, thank you so much again. So mental health first aid, just like, so let me break it into two, the mental health and the first aid. So when we say mental health, we're just talking about your physical and your emotional health in line.
Okay.
And so you are not sick physically and it will not have an effect on you mentally. There's no way.
Okay.
Because if I'm a BP patient now, I can take the BP drug religiously morning and evening. But if I am emotionally hurt, either by my husband, I am thinking about the failures of my children, whatever drug I'm taking to lower my heartbeat is zero. And so when we say you are mentally stable, it means that physically and then in tune with your emotions, they are connected. You don't allow the stresses of life to break you down. You are able to manage what is thrown at you. And so that's the balance.
Yeah.
When I talk about first aid, just like right now, if there's an accident outside, you see people, even without any basic CPR knowledge, trying to move the person away from the accident.
Exactly.
If there's a fire or something, you see them trying to put it out.
Yeah.
When we now come to mental health first aid, where is the first aid? And that's where I come in to talk about. So just like we offer physical support to people that are in danger, we can equally support them emotionally when they are going through various traumas. We have childhood traumas, we have marital traumas, everything. And in fact, unemployment trauma that is affecting a lot of youth lately.
Yeah.
We have parents that do not pay attention to the needs of their adolescents or their teenagers. And so they find solace in their peers, taking bad advices. Okay, so this is just talking about the public, knowing that when there's an accident, I will move the person away from danger. When I am emotionally down and you don't even have that basic knowledge or skills, you are able to even offer your presence. Your ears, your eyes, as I'm talking to you, the way you are nodding and responding to me. If I was emotionally down or having a moment, I will be feeling fine. Because then, of course, I know you are listening.
I'm connecting with you. I'm giving you my ears.
Exactly.
So you know that the person, is ready to, hug you, embrace you and say that, my sister, it is well.
Yes.
All will be fine.
All will be fine. And so imagine the whole public, the whole world has this particular first aid skill. The world will be a better place.
Of course.
Because you will not see me, I walk past you in the morning, I don't greet you, and instead of just drawing my attention, you start forming cliques and saying, oh, Gifty, now she works at this place or
because
this and that. She's now
she
bluffing. Meanwhile, I am in a moment where my mind is roaming somewhere.
You don't even see people are working
at all. Thinking about what can I take this moment to just end it all. And then you compound my problem by creating a scenario that is wrong. And I'm like, okay, so at home it's not conducive. At work, people, you understand, hate you. So where do I fit in? It is good to end it all.
Leave.
And so we are the contributing factors to people really ending their lives when we talk about emotional stress, where they cannot hold it.
Well,
yes.
We are the contributing factors when it comes to people ending their, when they cannot find us. Give them that comfort. Give them that assurance that, no, you're not in this alone. I'm with you.
Yes.
When you have your down moments, when you're going through that challenging times, I'm here. Come and talk to me.
Exactly.
So if we don't do that, we are the contributing factors, just as Gifty is telling us, when it comes to that. So this situation can affect anybody at all.
Everybody.
It could be, as she's mentioned, it could be work related, it could be hunting for job, it could be A family
Child,
related
yes.
could be children. I
Environment.
mean, I know somebody who says that my children are not doing well and all that, and she was really stressed.
She will be.
She was really, I mean, it can be very, very daunting on all of us when you realize that you're paying so much school fees, your
Yes.
children results come,
Yes.
and I mean, it can be very depressing.
Exactly.
So, just as she's telling us, let's always be mindful how we judge people without hearing their story first.
Exactly.
So, Gifty, you've done a lot of work in this area. I would like to ask you to tell everybody. Now, it's kind of mental health thing is becoming more relevant today. What's happening? What's the narrative? Because you are the one doing it. You are the one talking to people.
Exactly.
You are the one, I mean, preaching about it and all that.
Yes.
What's the narrative? Because now it's becoming very common.
Exactly.
Some children run away from home, and some children threaten their parents. I'm not happy. I'm this and all that.
Yes.
What's the narrative? What's the story like?
So the story is global. It is national. It is regional, in the sense that suicide cases are high now. Very high. Just last year, a lot of suicide cases about a student falling from a tall building in school, about a doctor committing suicide, policeman shooting. A lot of cases, right? And these are people that we dine with, we work with them, we train with them, How come we never saw any warning sign?
Because we're not looking.
We're not looking, or we're looking, but we're unconcerned, right? Or we didn't even know how to start the conversation. And that's where the mental health first aid training comes in, because I'm a trainer certified in US. I was training in US. So if you don't know how to start the conversation, in your bid to want to even support and help, you can always, you may make it worse, For instance, if I tell you, Mommy, my husband is doing this, I can't take it. I think I will end it all. And then you will go like, give to your life. You, my daughter, the way you love life.
Yes.
It's not possible. Yeah. How will you wear your beautiful boo-boo again? You know what I mean? So you're joking. Meanwhile, I was just really waiting for that word where you tell me that this is not enough.
No, calm down. There's not enough reason for you to.
Exactly.
Yeah.
Yes. So sometimes what we say to these things, our utterances, can either aggravate it or rather solve it.
Oh, God.
And so it's important that we all take care of this. In fact, we should take it very serious. So the reason why, back to your question, is because there are a lot of mental cases now. In fact, substance use or substance abuse is high among youth. People are resorting to things that they can find as solace.
Yeah.
And so in this discussion, I'll be mentioning some of the warning signs in between, okay, so that I don't forget them. So when I talk about it's not alarming in the sense that, so if I like eating right now a lot, people will be like, hey, now you want to gain weight. Or if I am not eating, you'll be like, hey, you want to do slimming course. These are warning signs.
Yeah.
Clinging to something that you used not to do. If I used not to eat a lot and all of a sudden you see me eating a lot, don't assume now I have the resources and so that's why.
Or ask questions.
Exactly. Or a husband, you and your wife, this particular lady that has not spared the food in the house. All of a sudden, she's not feeding well. She's not eating well. She will serve all of you and sip some water or some tea and be like, hey, wifey, now that you are checking your weight. Meanwhile, that woman is battling a lot of stresses.
She's struggling.
She is struggling at home. Or your child is sleeping a lot. And instead of you wanting to find out, this is not a normal routine for you, what is wrong? You are shouting here and there, hey, Amma, will you get up?
Lazy.
You're lazy. You are comparing them with other children. Have you seen Kofi at the next door? He's up already. He's steady. He has gone to university. You have been, you are just compounded. You are just increasing on the increased level. Meanwhile, this child is battling. This woman, this husband, this man is battling. And so whatever they find solace is either eating too much, not eating much, sleeping or not sleeping, or at worst, abusing alcohol or weed or marijuana.
Or pain relievers.
Or pain relievers, exactly.
Because I know that some few cases that I was aware of from people that the Third Ghana Foundation helping. And it was a particular lady. She was just abusing pain relievers. I called her. She would tell me every time she said she has a headache. And I recommended she see a psychologist. She said, you need to talk to her. Come and let's talk.
Exactly.
She came and it looks like there's no support anywhere.
Exactly.
Nobody's listening. Nobody's helping financially and all that. So she's thinking too much.
Exactly.
Definitely. the pain relievers won't
It's just
work,
temporal.
because the main reason is the underlying cause for the thinking is still pending.
It's still pending. Exactly, it's still pending. And so I think I need to bring her something that even pushed me into this.
Yeah.
Aside from being a lived experience, we call them lived experience. Like if
Yeah.
you have ever suffered any of the mental challenges, like mine is depression,
Mm-hmm.
it gives you the hope, especially when you come out of it, to know that I could have really died from this,
Yeah.
but I'm being able to come out of it. What helped me? Who were my support system that I was able to come out from?
Mm-hmm.
And so when you look back at where I come from, the Upper East region,
Yeah.
we do not have what we call Pantai here,
Mm-hmm.
or Ankafo,
Yeah.
or Accra Psychiatry.
Mm-hmm.
There's no mental health institution, and there are a lot of people battling stresses every day. So where is that structure where they can go into? And that's where health healing roles come in.
Okay.
We organize community debates. We talk to the chiefs, queen mothers, because when they say A, it is A.
Yeah,
So that
listen.
they listen. You don't tie some people who are battling mental stresses and say that they are aggressive.
Yeah.
You lock them in dark rooms and say it is as a result of witchcraft or the gods have punished you. Meanwhile, these are just brain distortions. And so I was trying to beat down the misconceptions, the myth, as well as create a platform where people will feel safe to talk about their stresses, to talk about what is wrong with them, and not see it as a trauma or a shame, and then reduce the stigma. And so it's important because these cases are rising. We even have rich people that are battling depression,
Of course.
are committing suicide.
Of
So you
course.
want to ask yourself, how is this man rich and have killed himself? It is because we are all
you
the
think
same.
he has everything.
Exactly.
Yes.
We are all human to begin
Yes.
with. And so the mind is created by God. How you are able to cope with the stresses or what is thrown at you will determine your mental strength capacity.
Yeah.
And so if you can fall at a point in time, as we have all fallen, there's nobody that have not been mad before, mad in quotes, because there is something that ever you were unhappy about. You couldn't sleep, you couldn't eat. That was a mental health challenge.
Yeah.
What made you come out of it? And what made me stay on it, that I'm now contemplating suicide? And that's where I need your support as a sister, a friend, a mother, not by blood link, but by the fact that we are humans to begin with. Where the world can be a better place. My worry is your worry. It is not a topic for you to discuss and sell me out. I don't come and tell you my problem, the next morning the whole compound
everybody
is looking at me with 3 and 4 eyes.
And you're like, oh.
And then I don't want to come out, because when I come out, they'll be pointing hands. The world can really be a better place.
And this is what you said, that after you've been training the chiefs and all that. You know, by saying that, my mind went on something. That mental health and all that. I mean, there are places where all of us go to find solace and comfort, like churches, religious organizations, the mosque, everywhere. This should be something that we should all focus on.
Exactly.
We should have, when it is the month for the mental health awareness, we should all celebrate, we should all get involved, because it bothers on everybody.
Exactly.
Sometimes our focus is so much on prayers.
Yes,
we pray, but you know, the physical being needs the comfort from each other.
Exactly.
We pray to the Supreme God, which we don't see, but because we believe in it, but that comfort, that is why he says that we should fellowship together.
Yes.
That fellowshipping. I think that, some churches have this health awareness week. But we should all robe into the mental health. Which month is the mental health? October. That's what I was my month of birth. The mental health month is a month that I would recommend every religious organization to also celebrate it.
Exactly.
If you are watching us and you're a religious organization, if you're watching us, you're a company, whatever institution you run, Mental Health Awareness Month, you should set a day aside to have somebody come and educate.
Yes.
You can reach out to Gifty. You can put your comment below this session, and then she will reach out to you, put your number and everything. If you want her and her foundation to come to your doorstep and then come and educate you, she's always available. And that's what she's available. She does. That's her passion. And she's so passionate about, she's so committed to it. And we are all here to support, because it bothers on all of us. Because sometimes, just as I'm running the foundation, yes, we help, we give education, but sometimes when you dig deep, It's not like the person who you are helping with the health condition. It's not like they don't have the means, but their mind is not even on the disease they are battling with, because deep within there's something eating them up. So I think that as religious organization, if we don't see a sister coming to work, to church, if we don't see a brother coming to church, if we don't see an uncle or something, we should all be concerned. We shouldn't just focus on prayers and getting money and building churches and building the fancy thing. Yes, they are very important, but it's the same we human beings who come and fellowship and do the contribution. So if emotionally the person is dying and the person doesn't show up, some places people don't go, but they don't even go and look for them. But yet if they start coming and they bring the money, we take. They will. We take. So this borders on all of us. If you are a school, you are running an institution, and you see a child backtracking. They are not playful like they used to be. And we only observe these signs when we pay attention. We only observe it when we pay attention. This is a time for us to all be committed to each other's needs, because it could be you. Today is somebody, tomorrow it could be anybody. So we all have to be part, and we all have to be concerned and committed into mental health related issues, because it borders on all of us. Please, what are some of the common misunderstandings that people do when it comes to mental health first aid? Sometimes people feel like, as we are discussing here, there may be somebody saying, hear what they are saying. They don't understand. What are some of the things that you want people to really get out of this, to understand and take mental health first aid more serious?
Thank you. So first off, I'm going to go practical. So that even if you forget anything we have said so far, you will not forget this. Okay, so my name is Gifty, and I've met a new friend called Alice. So Alice steps on my leg unintentionally. My adrenaline, which is responding to flight of fear of flight, will just flare up. Can't you see me? It is happening everywhere, even on our road. See what truck drivers or even private drivers will do. Are you using TV licenses to drive? Then they'll use the insultive words. We all know them. That is your ability to control your anger. My ability is to reassess what could have led Alice to step on my leg. Is it intentional or it's not? So I will just walk past, or I'll tap her. You stepped on my leg. Be like, okay. Sorry, I didn't see. Alice's ability to also control her anger or how to assess the situation will be like, did I see you? And then if I'm going to respond to the did I see you, I'll be like, I even calmly ask you stepped on my... So the two of us, how we are able to manage our mental processing is the hormones that are working in us. And that's why I'm saying that we should look at mental illnesses or challenges just like physical illnesses like BP, in fact, diabetes or anything, typhoid. Such a way that you will go and run laps and they'll say your typhoid level is high, take this and that. Now, in our own environment, we have been going through mental challenges without knowing. And that's why I'm citing that example. Your ability to just let go at that moment could save a life. In the sense that you don't really know what I'm going through, and you stepped on my leg. And so whether I react or not depends on your reaction to what I'm going to do. So if I ask you calmly, you stepped on my leg, you'll be like, get away. What were you doing here? You shout at me. And now adding to what I was already thinking at that moment, you've killed a life without knowing. We are two strangers who met. You are either helping me stay alive or making my life shorter by your reaction. And so that's why I'm saying that practically look at this. If right now my mommy tells me that Gift, you are useless, or tells me Gift, you are beautiful, you are hardworking, these two sentences, which will be positive and help me grow. The impact of our utterances is what I'm bringing at. That if I feel that if you tell me this thing, it could hurt me, it will let me bother and think about it and harm myself, it could let me grow mad or really begin to assess myself and say, am I really that lazy? Am I really, ugly? Am I walking and, I will begin to assess myself and I can stay on that mental challenge for life. Other than you telling me this, and tell me, you have seen my weaknesses. I'm not relating to work environment, our bosses. Oh, I've seen this is your weakness, but you are more than this. How did you pass? You went through a series of stages from JHS. You passed, you went to SHS, you went to university, and you are here as a nurse. You can go through this phase that you are in. And I believe in you. These are words of positivity and affirmation that can push people out of whatever they are going through. And so I am asking the public that is listening to us, take a moment and pause. In moments of stresses, in moments of pain, anger, ask yourself, whatever I am about to bring out, if it was said to me, done to me, how will I feel that night? Do I want somebody to go to bed thinking about the hurtful words or how you were treated? Or I want somebody to go to bed thinking that it was Gifty who said this positively that impacted my life and I'm able to have a sound sleep. Because when we don't sleep well, we don't eat well, that hormone called cortisol is our stress hormone. If it is high, problem. Physical health will come in, mental health will come in. When you're not able to sleep, that hormone to melanin is also another problem. You understand? So if you want to do anything to support mental health, especially people battling mental health challenges, it begins with how we call their conditions. Oh, she's mad. She's a drug addict. She's depressed. She's, hallucinating. Don't use those words. Simply say, she's in a phase. She's mentally challenged.
It can pass. It will pass.
Right?
People had gone worse and they passed.
They did.
It's just because of how others supported them. The support system.
Exactly.
So as Gifty is saying, all of us here, let's not use some words, because even the Bible says there is power in
our
the
words.
tongue.
Yes.
They say that life and death is on the tongue.
Exactly.
So you either use your mouth or your words to speak life or to speak death into somebody's life. So all of us listening, yes, parents, we get stressed, we get emotionally drained and all that because of stresses of life. However, how we're able to manage that has a lot of great impact on the kind of family and the kind of children we are raising.
Exactly.
And the kind of environment we work in. If you, as she mentioned, if you tell your child he or she is useless, I mean, this is death in a way, quote and unquote, that you are put in that child's life. But that child will go about thinking, oh, my mother or my father even says I'm useless.
Exactly.
What else is there again? You are drawing them further from you. If you like your children do anything and you compare, let's stop comparing. We are different people. God created us in different ways.
Exactly.
That's why some people are fair, some people are short, some people are a bit plump, some people are a bit slimmer and all that. Let's just embrace who the person is. Because we didn't create ourselves. The Creator knows. He has a purpose of the reason why He created us all differently. So please, let's mind our utterances. Let's mind how we use our tongue, because the tongue is very powerful. And that's what Gifty is telling us, that if we keep using those abusive words, you are going to let the person go. Think. And then its impact. The impact of whatever that we do or whatever that we say to people, what comes out of us to people, is what we should be mindful of before we come up with whatever we want to say. So, there are a lot of people who don't know about mental health first aid. There are a lot of people who may have a different perception about it until they get there, or until they get somebody close to them, gets there before they come to understand. In your practice and in your awareness drive, how has the acceptance been?
Okay. So, just like all of us from beginning, if we were not taught A, B, C, D, E, F, we were not able to know that B, E is B, G, O is go. So it's a process. We learn, we unlearn, we accept, we embrace. So knowledge is power. And that's why I'm happy you called me on this, your beautiful podcast or platform, because I am giving, in fact, right now there's somebody that's even planning to pick a phone and dish somebody, say, oh, it's me you were talking about, that I will show you my level. Don't show her your level. Because if God comes down and show us his level,
Oh,
we
will
will
not be
perish. You know,
Will not
we
be
will not
here.
be even be here at
No.
all. You know, because we commit sin through words, through action, through deeds. You know,
How we watch people.
you understand? So if he's going to show us his level, we won't be here. So that moment you're about to pick the phone, think about what you did a year ago and see whether you deserve to live.
Exactly.
You see, so let's look at this thing this way. As I mentioned earlier, we are trying to create an environment where it is okay to want to just walk to you and tell you the issues that I'm going through.
Yeah.
It's fine to be at this phase because you are human and stresses of life are differently, like we handle them differently. And so if I say, you go away, or you like that, me, I'll take it as, oh, you are playing. Somebody will not like that.
Yeah.
And so I'm happy you are always like you are reinforcing everything I'm saying. That's part of mental health. So in mental health, we talk about reinforcement.
Yeah.
You know, so encourage is also part of it. Like try to appreciate my efforts. I am a drug addict, like I'm abusing drugs, right? I have not taken it for even a day. As a parent, a caregiver, tell me that gift,
you've done well.
and that will boost my morale. From that one day, I can add 3 days. And before I realize I am sober.
Yeah.
And so we need that strong foundation from the home, from community, society members. Back in the days, in the 80s, where I am one of them, when any other person, like any society or a community member sees you at a certain corner with a guy or anything, be like, Gifty, before I close my eyes, you have vanished from there. It is not done these days.
You should disappear.
You should disappear and you really open your eyes and I am gone. You know, everybody was looking out for one another. But these days, it is not there.
No. Who are you to even tell somebody's child that they are doing something wrong and you call them to correct them? Who are you?
That is the thing. So how did we get here? You understand? Another thing that we should look at is the fact that we laugh at people. You know, it's so easy now. Like this internet. Open internet right now and see what is happening.
Yeah.
People are prying to people's family. You know, this Mr. Johnson thing that they said you know, why will you come out and say something that you say allegedly? It's allegedly, right? It's alleged. So why are you hitting on it? Just because of clicks, likes. You are looking at money, but you don't know the impact, the mental challenge she will go through, or anybody at all. So before you say any story or you want to leak, you are looking at money, money that when you die, you will not be buried with. Match that with the mental strain. Match that with the mental strain the person is going to go through by your allegedly, and they will be shouting, please, it is alleged, though. Why is it alleged? That means it is not true or it's not confirmed. So just zip it. Because what you are going to say might hurt the person, scatter the marriage, scatter his business. You know, you lie. Some of us we are lying to our bosses just to find favors and let them hate other people. How do you sleep at night? And that's mental health. So if you think I am mad and I'm depressed, you are also having a mental challenge because you are creating division. And when you're doing that, it means your mind is working differently, not according to God's plan, not according to Allah's plan. It is according to your own wickedness. And so you are also battling a mental challenge.
Of course.
That is how the world works. And so if you think I am by the road and picking rubbish, you are in a suit, in a nice dress, but you are doing worse. And so you are equally mentally challenged because what you are doing is causing harm, is causing pain to people. You know, so you and me who is picking things outside, who needs help? All of us.
We all need help.
We all need help,
We
right?
all need help.
We do.
That is why we are in this society together.
Exactly.
We are not. That is why God saw the sense in creating. After creating Adam, brought an Eve. Because we all need help.
Each other.
We need each other.
Exactly.
We need to. That's why when God, Jesus Christ came, He was not doing the work alone. He had the disciples that were going around. He could have done it alone.
He would have.
But why he
didn't have to work with people?
Because it means that we need each other.
We do.
We just have to make sure that whatever that if somebody does to me, it would not have a positive impact. I don't do it to somebody. We should let people who come around us have a safe haven around us. That, I know that as for Gifty, when I go to her, she will listen to me. Let people, I mostly say that as we walk about by our deeds, we are writing our legacy.
Yes.
If tomorrow somebody points their hand, this is Dr. Nanajo's child also. You're like, oh, really? your mom was such a person. This person, because of her, I did ABC. Because of her, I was able to do ABCD. What will be your story?
Exactly.
When your name is mentioned somewhere.
Oh, for this one.
This one. He was so evil. She was so this. She was so that. She was so that. We are all writing our legacy, it comes to generations behind us.
Exactly.
It comes to them. My father used to say when he was alive, he died at 110 years.
Ooh.
Yes, when he was alive, he used to say that. When people say that the evil men do lives after them, no, he lives with us and also lives with generations behind us.
It's true.
So whatever thing you are doing, you should make sure that if it's done to you or if it's done to your child, you won't be happy. Don't do it to somebody.
At all.
So this is what mental health first aid is telling us.
It's talking about.
That before you open your mouth to say a word or a phrase about somebody to another person, assess it. If this one was said about me, how would I feel?
And that's first aid. It means you are giving first aid to yourself even before to someone else. Yes.
When it comes to mental health issues, there are a lot of myth.
Yes.
Plenty. Share some of us.
Okay. I'm happy you have asked this question because that is the reason why these struggles we are trying to, these gaps we are trying to close are not working because of the misconception. One known is that I'm going to talk about the men.
Yeah.
When he begins to express himself, you are weak. How did we get there? When his own is not petrol and mine is blood, all of us is blood. How come he is expressing himself and he's a weakling, but I am a female? I am, you there, you can express yourself. That is the greatest trauma we can give to men. We should be able to let them express themselves. Imagine in marriages, just like there's domestic violence for women, there are also women that are beating their husbands. But when he comes out and he says it, how did you allow your wife to beat you? And so he's in it, receiving the beatings. He either leaves the marriage or he kills himself. So that is one myth.
Because that's the thing. It means that he cannot even go and say it anyway. Because they say he's a weakling.
I'm telling you.
So you keep quiet and then one day ends it.
He ends it all. Or the wife is cheating on him. If he comes to tell a group of his friends, like, hey, you there, why? You don't last in bed or what? How come your wife is going out to look for it somewhere?
Oh, God.
You see all these utterances. We are compounding. We are worsening their situation. Another myth. Witchcraft, then you did something wrong. It's a witchcraft, it's witchcraft.
Oh, yes.
God have punished you, or the gods in your land have punished you. You did, that is not possible. It's not true. Mental health is brain distortion in your emotional capacity. Your capacity to deal with daily stresses can put you off balance. You understand? And so when you are outside for long and you are bitten by mosquitoes and you test and it's malaria, it is the same way that I've been battling with unemployment for 3 years. How do you expect me to survive?
Of course you cannot. And it will be mental draining.
Exactly. Because when I get up, I don't have a purpose. There's no focus. Everybody's leaving and goodbying me. I'm going to work, and I'm just sitting down. So me, Nupan, where am I going to?
That's why people will ask, God, where are you?
Where are you?
Are you for us or
against us? Exactly.
How come my friend all finish school at the same time? And they are working.
Exactly.
They are in a job which is very, very lucrative. They're doing something. They found their purpose. But I am staying at home. I've been home all these years.
Why? So that is it. So mental health is not as a result of witchcraft, witches, or a curse from God or the gods.
Or a man is a weakling.
Or a man is a weakling too. So that's the two things. The third one. Mental health. If you have it, there is for life. It's not curable. How is not curable? If I have been cured of depression, it takes my own efforts and the medications that you are put on to set you back to balance. If you say it's not curable, how come you take malaria and then you are fine? Your feverish feeling body is gone. Mental health is manageable. It is curable when identified early. When me and you perform mental health first aid, right from our homes to our schools to our office to the community at large, where we are not discriminating and tagging people as drug addicts, as you there you are mad, hey, you there you are crazy. No. And then the last one is, if I want to go and seek for help, professional help now, support now. The other myth is that, this thing that you are going, it will not work. You are just going to waste your resources.
You are going to waste money.
You understand? And your time. That is another misconception people have out there. Because I told you that just by virtue of how you approach me, how you talk to me, can heal me. And that is important. And so allow the people, in fact, rather connect them, advise them to seek for professional help. But the advocacy today is that you can perform first aid, mental first aid,
for the people
by being present. How you communicate, how you know when they are talking. Welcoming. I do not come to start telling you my problems and you are busy on your phone. That is not welcoming.
You're not giving attention.
I do not tell you this is happening in my life and then the next morning the whole community hears about it. That is not mental health first aid. You understand? So there is help everywhere. In fact, Accra, they are there plenty. But for places where, like my region, that it's not there, we have community mental health nurses, we have psychiatry nurses, right? In the hospitals, in the health centers. If you are battling with any stresses of life, you are dealing with alcohol, drugs, mentally you're unstable, you sit down and you are fidgeting, you're shaking, your mind is not able to process things, daily things that you used to process. Walk into any health center. And access your mental health services. In fact, I learned the government is trying to reduce that cost or even make it free. Just like the way HIV drugs is free, because it's a border to people. In fact, most of the people that are even suffering from mental health challenges, most of them cannot even cover the medication. And so even my foundation will take care of some people back in the north. We supply them with their 6-month medications and all, because those that can help them, bring them back to normality is what is out of the National Health Insurance Scheme, their drug list.
It doesn't cover.
Exactly. So that's why we're also advocating that government should really see to this, because we need everybody to have a sound mind to work, to increase productivity, to make the country well, to make your family well, to make the community well. You understand? We have people who are aggressive because they are mentally unstable, living with family members.
And they see them progress, and of course the person will be aggressive.
Exactly, you understand? So you see, you go out and you come and then your grandmother, grandfather, the children all are slaughtered. How did we get there? It's because you in fact, you closed your mind that, this one there, you be like that, you are crazy. You come back from work and your whole family is gone. How come people are using machetes and they're using guns and shooting people anyhow? You think it's normal?
No,
there's a distortion there. And so if let's all fold our arms and say, this one, there's not my house matter. It will extend to you. So let's be each other's keeper. What I don't want to hear you tell me, I will not tell you, because it will not let me sleep. It will not let me eat. It will distort me. And so knowing this, before I open my mouth, I will have a first aid. I will apply first aid in my mind. No, this thing you're about to say is not good. Do you know what it will happen to this person? In fact, do you know her mental state now? So don't say it. And you have performed mental health first aid already. But when I talk of mental health first aid in the professional term, there are a set of skills that we train people. And then we have a tool, just like a carpenter or even this studio. See, you're using camera and lighting. That's their tool to make it nice. Mental health first aid tool, we have our tool. It's called the ALGE. It's an acronym where we train people. I will just mention them. So when we say A, we are looking at you assess first. And that's where you were talking about the observation. We see every day, but we are quiet. Or we see every day, we ignore. They tell us, we ignore, we make fun of it. When you assess, you assist. And that's now you being present. You creating that room where you say, it is okay. I am here to listen and support you. The L in the LG is talking about the listen. Listen non-judgmentally. Not just listening. You listen without interrupting, without shouting, without, it's true. Me too, I felt like this. I know somebody. No, don't compare and contrast. Just listen carefully.
Every case is unique.
It's unique, so you can't say, me too, I ever battle. We don't do that in mental health first aid. You are trying to put them off, right? Then the J is give assurance. Like you did, you said, it's okay. It's a phrase. It will go. With the E is what encourage professional help. With professional help, you'll be fine. The last one is encourage self-help. Sometimes, what are the things that when you are troubled, it makes you easy? Is it listening to music? Is it jogging? Is it like visiting your family? Something that can just take that edge away. Like this
singing.
Exactly.
Whatever.
like this people that I take care of, like the substance use at the challenge people. I don't call them drug addicts.
No.
They are it's substance use challenge.
Of course.
It's a challenge. Exactly. So I assess them. There are some of them. Most of them were good in this. What do you call them? Sandals, sewing, those things.
Yeah,
so I'm like,
the craft stuff.
Exactly. So at that moment where the edge is coming out from, just look around the environment. What can take away your mind? Is it like trying to repair a sandal right now, or just going out to walk around? There's a guy on TikTok that I'm following. In fact, the guy is trying. The first step to getting better is accepting that I have a problem, and then I'll do well to get out of it. So he's like, I don't know what I should say, former. Like he's struggling with marijuana right now. So whenever the edge comes, he will all put on his camera because we are looking at him, right? And so if he comes online, he's taking the weed, police might get him, right? Yeah. So he'll put on his camera. And so that is his means of
staying off it.
And fighting the edge. So he put on the camera, walk around, do jogging. I'm looking at you, and so you would not smoke at that moment. So he has found his strength. Anytime the edge comes, he owns his camera, and then he's jogging. And he said, this is how I'm going to take the edge away. You to look in the environment. If there's people that you can find, and that's why I'm always encouraging that when we are observant, we also really assist. Observe and assist. Be present. When somebody finds you as a confidant, make sure you don't misuse it. Don't broadcast. Give the person your time.
There's a reason why the person chose you.
Exactly.
There's a reason.
Exactly.
So you don't go about telling people, oh, this person came to tell me this. Gifty came to tell me that she's doing this. And everybody, and then somebody come out and then go and say, hey, Gifty, this and this and that. Yeah. I remember way back when I had my first baby over 23 years ago, and then he was like 5. And me, not to really say that is what everybody does, but there's one thing I don't really do. Like I go to church, all right? There are days that when there's an activity and I feel like I'll go. But there are some particular groups, in churches. I don't belong to any particular group. I rather support the Sunday school with things that will make them happy to wanting to come to church every time. And then there was this, I had heard a group of women talking about it because I like wearing high heels. Yeah. And I had heard them say that, high heels, then I heard it, and 2 weeks later, one of them walked to me and came to tell me, I gave it to her. And I said that, I'm happy that they sent you to come and tell me. But where in health do you have the evidence that they say that if you wear high heels, you cannot be pregnant? Wow. I've been wearing high heels before I even had my child. And besides, if myself and my husband, we had decided that we will not have children again. It's our decision. So please, when you go for your meetings, tell them to stop talking about people. But that is what is not making it attractive for some of us to join.
Exactly.
So you see, it's not things that bring down people's souls. It's sometimes when you go to places of worship and fellowship,
where you want to find comfort.
You hear, instead of you finding comfort, you rather hear things that will rather bring your spirit down.
Exactly.
And sometimes people don't understand why people are leaving some churches, people are leaving some religious organizations, because they don't find comfort.
It's true.
They rather go and sit somewhere else, and then sometimes people judge them that, he's not a Christian. He's not. Being Christ-like is not judgmental. You don't judge people.
Exactly.
Because you don't know the reason behind their story.
Exactly.
I tell people, I don't judge anybody. But probably if I'm the one in that person's shoes, I'll do worse.
Exactly.
So before you just listen to somebody, and Gifty, why are you doing this? Is everything all right? Let her tell you her story. If you can encourage, if you think that she needs to seek professional help, if it's beyond you, encourage the person to seek professional help. Instead of rather pointing fingers, have you seen Gifty? Today look at how she's dressed. You don't know her story. You don't know what happened before she even left her home. Why she doesn't even look at herself. Why she's not looking her usual. instead of you to go closer and ask,
Yeah.
you're rather there pointing fingers. So when by what Gifty is saying, mental health first aid is being empathetic,
Yes.
not judgmental.
That's it. That is
being
it.
empathetic and not judgmental.
Yeah.
Mental health. All of you listening to us, this is the heartbeat. When we say heartbeat, you say one heartbeat at a time. Because matters that we discuss on the heartbeat borders on things that beat our hearts. Because mental health, for instance, the heart is connected to it. Because it affects your emotions. It affects everything. Things relating to health affect our heart. Things relating to life and well-being.
Yes.
And that is what the heartbeats we talk about. So we're talking about mental health first aid and then mental health generally. And with me, it's Gifty, my adorable daughter. That's what I call her.
Yes.
Who can worry me? She's the only one of mine who can really worry me.
That's true.
Because she doesn't budge until she's a very strong-willed person. And I'm happy that she's been able to use what would have been worse in life of other people, and she's rather using it to support and bless people. So if you are watching us and you know somebody battling with mental health challenges, if you observe anybody and you think the person is not themselves, please put a comment below this video and then we'll get back to you. We'll link you up with Gifty's Foundation and they are available to support in any way possible, professionally, because she's a professionally trained mental health nurse and she's advocating to all of us. If it's not you today, don't think that you are free because mental health borders on all of us. It's to everybody.
Exactly.
It happens anytime in life. It could be lack of money, lack of food, lack of basic social life needs.
Exactly.
And it can drive on into becoming something very, very big.
Exactly.
Gifty.
Yes.
When it comes to mental health, is it dedicated to only one profession?
Okay.
Because the first aid, sometimes people feel like, oh, this one is about health workers.
No, it's not. So just as you said, it's not for nurses, doctors, or midwives. It's for everybody. And that's why when I started off, I said if there's an accident outside, I didn't say we'll have to call the nurses or the ambulance. I said many people who are by the roadside or where the accident occurred will start picking the person away from the scene.
Yeah.
You know, if there's fire, you see them trying to, quench it even before the fire service come, right? So mental health first aid is our ability to respond to someone's emotional crisis or someone going through mental health challenges. In our home, school, work, we talked about that, right? So it's for everybody. For the pastors that you mentioned, malams, sheikhs, teachers especially, because they are dealing with the youth. Parents, caregivers. That means anybody that is not living in the sky or on trees, you are living on earth with human beings. You have daily interactions with human beings. You can equally observe and be able to support people going through different types of emotional crisis. So mental health first aid is for everybody, most especially for parents, because right from the house, you should be able to spot these warning signs. Then the person, when the child is not in school, the child is not at home, the child is at school. So the teachers are also supposed to be trained in this. They are always able to spot. I'm happy you mentioned some of the things that a child is withdrawn or all of a sudden failing. And you'll be like, oh, now that you are lazy. No. You, as a teacher, that word should never come out from you. You would want to sit the person down and perform LG, the mental health first aid tool. You assess, you assist. What is going on lately? With a nice smile. Then you ask and you pause and let the person take it in. Sometimes they are ready to voice it out. Sometimes they're not ready to talk about it. You cannot force them and say, I'm your teacher, I'm asking and you are quiet. No, this one is not about teaching me maths. These are emotional challenges, and it takes a lot of effort to want to really always bring it out. So you have to be patient, and that's one quality of a mental health first aider. Your ability to really be patient and follow up on one person. If you're able to save one person at the end of the day, you have done so much.
lot.
And if whoever you believe in, whether it's God or Allah, have written it. Sometimes I always tell people that my home in heaven is chamber and hall, self-contained, everything, and they'll be laughing because what I am doing is what God really will be like. Oh, Gifty, even if it's two people, you have been able to bring them out from committing suicide at the end of the day. You deserve that chamber and hall. And that's why I'm always saying, like, let's do something knowing that there's somebody up there that is scoring us by our deeds, by our actions. Okay. So ask yourself, after being 35 years, what have you done for somebody that did not pass through your mother's vagina? That is by blood. What have you done for somebody by the road? You just walk past and then that is it. No, let's not do that. So this is for anybody that have daily interactions with people. So wherever you find yourself, you are also supposed to be trained in mental health first aid. If you are not able to get that opportunity to be trained, at least you have heard from us. We have given you the basic things you can do, which is not even being judgmental, as Mommy said right now, but being supportive, being present, knowing that I can also be in this situation that this person is going through, because brain is brain everywhere. And how she is able to process things, it can equally happen to me. And before I shout or insult or gossip or do something, what if I was the person? How will I feel? When we do that, we are already performing mental health first aid without even being trained. And the world will really be a better place. A place where, hey, do you know that my depression is not gone? No. Just like I'll tell you, do you know my typhoid is back? And so we have taken away and we have kicked away stigma. And so everybody is free to go and seek for help. And a man is able to voice out what he's going through without being called a weakling. You understand? And I can tell you, I am feeling this way without you be thinking that I'm not a Christian. God has punished me. Or my God, those things will be done with, and people can access mental health services without any tag, without any name call. Oh, the family of these people, they are all mad. Are you not aware? You cannot marry from them. All these tags are killing people in our society. And so let's put a stop to it.
Let's put a stop to us saying all those negative things about people, because that is what is taking away people's lives. It's taking away people's livelihood. It's taking away people's self-esteem. Let's rather build people instead of unbuilding or instead of killing people. This is the heartbeat. When we say heartbeat, you say one heartbeat at a time. Gifty, what role do institutions, government agencies, workplaces play? What can they play to make the mental health awareness more accessible?
All right. So just as I also mentioned earlier, the fact that some regions have at least about 2 or 3 mental health facilities and some regions do not have, like the 5 regions in North, the 5 regions of the North, Northeast, Savannah, Upper East, Upper West, Northern region itself, we don't have a single mental health facility. We don't. So imagine all the aggressive people, the schizophrenia, those who are just like carrying a lot of load everywhere. Some of them need rehabilitation. So even if we cannot build these huge centers like Pantine or Accra side, at least we can build rehabilitation centers, right? So that those who are struggling with substance use, alcoholism, or mentally depressed because of maybe domestic violence cases here and there, teenage pregnancy, that are trying to find their feet and do not know who to talk to, they can walk into these centers to access these programs. So government should try, at least every region, there should be a rehabilitation center. Every region, that is one thing I want government to do. And then the subsidy or even ruling, in fact, including more mental health condition medication onto the health insurance is very important. It will help a lot of people.
The person is dealing with things and then getting the support if the medication is also expensive and they can't afford.
It's a problem.
There's no way the person will get back.
Exactly. So those are, and then the institution-wise, whether it is a hospital or it is a school, I expect management of these institutions, banks, anything at all. You should ensure your staff are trauma-informed. And that's one of my specialty as well, trauma-informed care. Where I know that you might be facing some various traumas. And so I must, first of all, appreciate you as a human being who might have trauma, like childhood trauma, environmental trauma, even work-related trauma. And so I treat you as a person and not label you with your trauma.
Yeah.
So every institution should ensure that their staff are trained in trauma-informed care.
Where do they assess these training?
So my organization does these trainings as well. So we have something we call trauma-informed care training, and then the mental health first aid training, where when you enter a particular institution, you can feel that all the staff are trauma-informed. Even right from the reception, how that lady or guy speaks to you. Oh, hello, you are welcome to this and that. Mm-hmm. Oh, okay, you are here to see somebody. Kindly write your name. Please wait. I'm going to... All the words, the please, the smiles, shows even from your reception that they are trauma-informed. Mm-hmm. They treat the person as human and not even with their trauma, not in their state.
And how they are dressed.
Exactly.
And don't discriminate.
At all. And as management too, you hear cases, different cases all the time. You are able to apply trauma-informed, knowing that let's look at it from A to B. Okay, I've listened from your part. What did this one really do? You listen from both sides and you apply trauma-informed. You assess deeply what could have led me. All of a sudden, I'm always up to date with my reports. Then lately, I submit reports late. And you forget the years that I've always been on track, and you are dwelling on my 6 months where I am emotionally battling depression, and so I am not up to date with my reports or being who you think I was, and so you are going to dwell on that to punish me, to say I'm sending you this way, or I think you are no more performing, so you do know what, quit, or a trauma-informed institution, whether a bank or anything, school, is a place where you treat people knowing that they might have faced or are battling with different traumas. And so treat me as a person first, assess me as a person, give me the needed help, even before you want to apply whatever sanction you are talking about. Because if I am contemplating suicide because of emotions, right, and I come to work and you give me a letter, a sack letter, or a suspension, or without pay, you have even ended it now.
Of course.
So I take your letter, I go back home. The next week they bring you a letter, obituary. She has passed. And you will regret for the rest of your life. Why didn't I do this right? Why didn't I offer professional help like psychological assessment, and know that Gifty has always been a hard-working lady. Of late, she's now she's not doing well. Yeah. Let me treat her.
Ask Gifty, what is it?
What is it first? It's always... lately you are not doing well. If you cannot do it, go. We'll find somebody else. Abba, before the work, I am a human being to begin with. So let's treat each other like that. And everywhere, in general, right from wherever, we are always looking at, US is good, UK is good. It's because of their structures. Of course. So still back to the institution. They have put in place these structures to help people that are battling emotions. They are trauma-informed, and that's why they can carry about 750 youth like that. I'm a Mandela Washington Fellow. They are so not greedy in the sense that they will pick people from South Africa, Sierra Leone, Ghana, to train your people and let them come and be like what I'm doing right now. Without that training, I will not know what mental health first aid. I will not know what trauma-informed is. And I'll just join the masses and will be insulting people everywhere, judging people everywhere, and causing more trauma to people. And so that's what I want the institution, right? Whether you are a manager, CEO, or whoever you are, before you judge your worker, try to listen to both sides and offer the professional help even before the sanction, because your final letter can put that person to the final thought as well, which is the suicidal ideation. And so let's always ask the relevant question: what could have gone wrong? Do you need professional help? Do you need us to do this? And as workers, colleagues, let's in fact also go the extra mile to want to call each other when we don't see a colleague, or even want to visit and find out what is going on.
Or even see that, as for this way, she's always on point. Yeah. But today, she's looking different.
In appearance, and you are judging.
You are judging.
Yeah.
Let's ask.
Exactly.
Is everything okay?
That's another warning sign.
Maybe the person might not have even seen they are not looking themselves.
It's a warning sign. I told you that I love to appear good. And now, even to comb my hair is trouble, nothing. And you think I'm fine. And I'm also somebody, every Friday you see me at a pub or a club. Just to, and then you call me, Gift, today let's go to
and whatever. I'm not going.
The music is always too loud. I don't like it.
You'll be surprised.
So that's a warning sign. You should want to even do more. You want to find out more. This is not usual of Gifty. Complaining about music, the sound of music.
Somebody who wants to be there.
You understand?
Enjoy.
Like mommy, that I like taking pictures. If for a whole month you don't see me post, you have to come to the house and look for me because it's not normal. So we know some routine of our colleagues at work work, our partners, our children. When there's a drift, you have to perform mental first aid by asking the relevant question, being there, and performing trauma-informed.
Yeah.
And that will be all of it.
We need to be patient.
Yes.
We need to pay attention, and we need to be there.
Yeah.
Not just there, Keke. Be there and be there. Be present.
Exactly.
It's not like the person is talking to you and you are on your phone. The person is talking to you. You are wondering. You are just. It's like in you've checked out.
Yes.
Yeah, you're there. The person is talking, but you've checked out. The person will spot it.
Exactly.
Because the person will feel like, I'm talking to them. Why should I continue?
Exactly.
And sometimes the person may pause because you've checked out your mind and you're not listening. The person you won't even realize that the person has paused and has stopped talking and is watching you.
Exactly.
Let's be there and be there. Not just that we are just there by our body, but our ears, and then physically we are not really listening.
Exactly.
We need to be there for each other. We have to be each other's keeper, and we have to mind our utterances, because today is somebody, tomorrow it may be you.
Yes.
Because mental health borders on all of us, and sometimes situations change. A table can just turn.
Exactly.
It can turn without even a warning to you, the individual. Exactly. So let's all be careful about how we handle issues. If you're watching us, this is the heartbeat. When we say the heartbeat, you respond one heartbeat at a time. And we discuss matters bordering on health, well-being, and lifestyle, because that is the heartbeat of our humans. And that is what our interest is. If you're watching us and you're enjoying this, please, and you have any questions, you know somebody, your institution, you want Gifty's Foundation to come in and train your staff, put a comment there, put your number. She'll reach out to you and she would do the needful. And please, as she has stated, she wants government to support, especially drugs on the NIH. This one, let me also add my voice. If all the drugs that are used for mental health management covers, or the NIH covers it, I think that it will make the care much easier and much accessible. Because some people go, when they go and they are giving the prescription, they can't afford. That's it. They go back. And then it gets worse. Because as there's no attention, no medication being taken, just as we say that if somebody has a typhoid or any blood pressure and they are not taking their blood pressure medication, it keeps rising up and rising. And one day, by the time you realize, the person may suffer stroke or something more serious than if we had given the medication on time. So please, government, we are asking you, we are begging to make sure that the mental health medications are covered under the NIH, so that when it's prescribed to people, because it can be anybody. We see prominent people losing their children to suicide. We see anybody, like somebody, sometimes people get surprised. But that's Dr. Smith's child. That's Lawyer Smith's. That's that. Sometimes we get surprised about the news. Let's not wait to get surprised. Let's observe the warning signs. Let's talk to people, and then let's make sure that we offer the help that we can. Our last segment. It's called the fire. With this one, when I ask the question, within 10 seconds, you give me an answer. So there's a myth that mental health first aid is just for psychologists and a doctor. What's your stake?
It's not true. It's for everyone.
Gifty says it's not true. Mental health first aid is not for doctors and psychologists, for everybody. So all of us we have to make sure that we take whatever we've discussed here seriously and offer a helping hand. The next one, talking about mental health makes it worse. That's what people say. True or false?
It's not true. It rather eases out the tension. It eases out that emotional tension. So it's not true. So
Gifty is saying that talking about mental health doesn't make it worse. It's not true. It rather eases out, because when we open our arms and we listen to people, people then trust us. And please, when people entrust you with the information, don't go out there and
broadcast
it. Gifty. The next one, true or false. If someone says is struggling with mental health and people say that it's only weakling who struggle with mental health, they have to be strong and handle it. What do you say?
It's not true. Even the strongest of persons have also undergone all challenges that you can think about: depression, panic attacks. So it's not true.
So if your mental health is not for the strong or the weak person, it's for everybody. Yeah. The next one. Some people say that if you say the wrong thing, that makes the situation worse. About what does mental health say?
If you say the wrong thing, it's true, because as I gave you the example, if I say I'm contemplating suicide and you play about it and joke about it, it will increase my emotions and my even really, or if I tell you something and the next morning you broadcast it outside, it's really going to affect the current situation. So, that is another thing.
Your final words to our viewers.
Okay. My dear viewers, thank you so much for staying till now. This is very important and dear to my heart, and I hope you take it seriously. What I want to tell you is that in this life, before you are where you are, you crawled, you walked, you ran until you became who you are. Take life slowly, on your own pace. Do not compare. And so I was at a different place and I talked about preparing for the year mentally. How do you prepare mentally for the year? You set your goals and say, Chinchina, this year I will marry, I will give birth. Without adding, I will die. How come we don't add that as well? Because it's something that can happen. Yeah. So I am telling you today that do your best. Do not look at A, B, and C and use that as a compass for your life and build a lot of emotional stresses. Take life slowly, one day at a time. Like the slogan says, one heartbeat at a time. You put so much effort on yourself, so much timeline, so much goals, without knowing whether your mind is able to assess and prepare you for that. So please do things in accordance to your strength and not according to what society says, like the giving birth. Everybody and their time. There are people that have struggled to give birth, and at the end of the day, the children are giving birth to, but the women die. So societal pressure on women who have not been able to conceive. This is for you. You have killed a lot of women. You have broken a lot of marriages with that thing. You married last year, no child. You give birth to mommy. They'll say,
yes,
that one, only one child.
5 years. Your child is 5 years.
You add again. Yes. Then you add another one. There are only 2 girls. Hey, only 2 girls. Your husband will go out and marry another one. So you are now struggling to add a boy. In that event of struggling, you might have had postpartum depression or even BP or any kind of illnesses. The doctor have said take it easily, but because you want a guy now, because you don't want your husband to go and marry again, you go and give birth, you get pregnant, then you develop complication, you die and leave your husband and your children because you were trying to fulfill a goal not determined by God but by society. So continue to please society and see how it will affect your mental health.
Please. The word to the wise is right here on the podcast of the heartbeat. Yes. So we say that one heartbeat at a time. Gifty has summarized it all. Don't please society. Please society and die. If you love your life, please do what makes you happy.
Yes.
Not what society says. If you place so much demand on yourself to please society, because to you, your friends married at age 27, you are 35, and so what? When people say things, I say, at God's given time, it would happen.
It will.
So please, as she has summarized it, mental health, those of us who made New Year resolutions, and you have put a lot of stress on yourself. You are putting so much stress on yourself. As for this year, I must marry. You are saying you must. You go and choose the wrong person, and the person will beat you to death. You go and choose the wrong partner. You must have second child. It's not happening. You are doing everything. You are drinking concoctions. By the time you realize you have developed a kidney and a liver problem, please, don't live your life to please society. It's not about what people say. It's not about what society is telling you. What is your strength? What can your strength carry? take life one day at a time.
Yes.
Just as we are talking about life, health, and well-being on the heartbeat, one heartbeat at a time. I have been your host, Dr. Nanaja Kunedu. See you again in our next episode. Thank you for watching, and keep your comments, subscribe, and share. The Heartbeat was brought to you by Theraghana Foundation, the Salt Pal, Tulipa 369, and Adenta Credit Union, and also the Theraghana Foundation. Keep being with us and be blessed with what we share with you. Thank you very much.